Fibroids are non-cancerous growths of the uterus, and some people can have fibroids without even knowing about it, and for others, the symptoms can be quite debilitating. So here are some symptoms that you could have if you have fibroids. Firstly, heavy or very prolonged periods. So if you are bleeding for more than 7 days, or if your period is extremely heavy, so you have large clots or you're flooding, so in other words you are soaking a period product within an hour or two, or you have to double up on your period products, or if you are becoming anemic as a result of how much you are bleeding. Heavy and prolonged bleeding are one of the signs or symptoms if you have fibroids. Pelvic pain or pressure is another potential symptom of fibroids. So if you have this persistent dull aching in your pelvis, or the sensation of fullness or pressure in your pelvis, or maybe you have pain on intercourse, also called dyspareunia, and the pain may even be radiating or spreading down your legs or down your back. Pelvic pain and pressure may be a symptom of underlying fibroids as well. Swelling of the abdomen, or like bloating, or again this feeling of just being super full. You may even have a bump in your tummy. You may even be mistaken to be pregnant. These are also some symptoms of uterine fibroids. Frequent urination or difficulty passing urine may also be a symptom of fibroids. Especially if the fibroids are very big, they can put pressure up against your bladder, and that can cause urinary symptoms. So it may even feel like you have a urinary infection, or you may have to kind of strain to empty your bladder because of the pressure that the fibroids are placing on your bladder, making it difficult for you to fully empty your bladder when you need to go to the loo. Constipation is another potential symptom. Again here, if you have large fibroids that are pressing up against the rectum, can make it difficult for you to poop. And again, this can lead to bloating and that sensation of fullness in your pelvis as well. Other symptoms may be related to pregnancy or difficulty conceiving or fertility issues. So depending on the size of the fibroid, where they are located, how many they are, they may interfere with the potential pregnancy. So you may not even know that you have fibroids, but you just know that you're finding it really difficult to conceive or to get pregnant. Or you may be at risk of recurrent miscarriages. That's because sometimes the fibroids can take up too much space inside the uterus or interfere with the lining and where a potential pregnancy may be able to attach on the inside of the uterus. So infertility issues or fertility or issues surrounding either getting pregnant or staying pregnant may also be a symptom of underlying fibroids. And they can sometimes also lead to some complications within pregnancy, so preterm labor and issues with the placenta. So there's a condition called placental abruption, which is where the placenta detaches prematurely when you're not actually ready to be giving birth. So the interruption or the interference with pregnancy can be as a result of fibroids growing inside the uterus. Fibroids may also lead to irregularities in your period. So if you are bleeding or spotting between your period, this may also be a result or a symptom of underlying fibroids. So if you're having any of these symptoms, it's super important that you discuss them with your doctor so that you can get tested and investigated to see if it's possible that fibroids may be at the root of your symptoms.